Tell us what your plan is. We have an outline of it we'll put up on the screen as you talk, but tell us exactly what you're adopting today.
You bet. So, as you know, the Affordable Care Act is just not working for so many people, premiums doubling, access going down. And so what the president's been committed to is getting more options that are affordable available to people. And what we are announcing today is the approval of short-term limited duration plans. These are plans that are individually underwritten by the insurance company. So an individual does apply for them, and they can cover various conditions. They can be priced appropriately to whatever is being covered, and these were available throughout the entirety of the Obama administration for up to 12 months. And then right at the end of the Obama administration, they clamped them down, allowing only 3-month coverage because they wanted to force people out of these cheaper options into the Obamacare exchanges to try to shove people in there. We are restoring these plans to be available for up to 12 months, and we're now allowing them to be renewable if the insurer and the individual agree for up to 3 years. These can be 50 to 80% cheaper than Obamacare exchange plans. So this is a really important new option for millions of Americans.
Well, Mr. Secretary, it's very difficult to argue with cheaper health insurance. At the same time, you get what you pay for. And part of the reason it's cheaper is because it covers less things. Isn't that correct?
So these plans will be cheaper based on the individual underwriting and the negotiations between the individual and the plan, and they may not be right for everybody. So the kinds of folks that I think these are most likely right for are people who are in transition between jobs, the gig economy worker who's an independent contractor and doesn't have employer insurance, the person who's got 3 part-time jobs with no employer insurance, and the kid who's headed from college to their first job and has a gap, or maybe the person out in rural America who may have access to one Obamacare plan, but it's unaffordable or it doesn't have the hospital or doctors and network that they need. People should go in with their eyes open, and that's why we've actually put more stringent consumer protection controls and notice requirements in than even President Obama had when he had these plans.
Right, fair enough. But just to be clear, it's those consumer protection things are to disclose to the person that they're not getting covered for as many things as they would under an Affordable Care Act approved plan. Is that correct?
So that is part of the disclosure, is that these do not qualify as essential health benefits, and they may have caps on coverage, and so people should go in with their eyes open. But the days of us in Washington telling people the insurance that they have to have and want to have are over. We're giving these kind of options to people. They need to choose. They need to be in the driver's seat. We have confidence that individuals can make the right choices rather than just bureaucrats and ivory tower folks telling them what they ought to have.
Yeah, fair enough. But at the same time, just to be fair, the way insurance works is you want people with higher risks put together with lower risks by and large so that it evens out over time. And isn't part of the rationale for, as you said, forcing people into the other to make sure that we have a full complement of people in the plan? As a practical matter, might this not lead to people who have less risk and therefore they can afford less coverage, be getting separated out and therefore making the price go up, or even there not be coverage for the people with greater health risks?
Well, that was actually the fundamental flaw of Obamacare in its original design. It was designed to over-subsidize certain individuals at the expense of others. And what happened was those people who were being asked to foot the bill so extensively for other people fled the market. So right now in the Obamacare exchange markets, 87% of the people in those exchange markets are being subsidized by us. We are effectively paying for their insurance, or a large portion of it. The people who are not getting their insurance bought for them by us have largely fled that market because they find it unaffordable. It doesn't meet their needs, and they're either uninsured or having to find other vehicles, and we're just providing additional options for them. I really don't think that there's a risk of people leaving us buying insurance for them to take on these options. These are for the forgotten men and women, the 28 million who've been left out by the false promise of the Affordable Care Act of not having affordable insurance, not having access to different plans and choice, and not having access to the doctors they wanted.